Labor is one of the most beautiful things a woman can experience and also one of the hardest. It's important to know the warning signs and what a woman can expect from labor. Here with me is Dr. Herrmann. He's with Women's Care, and he is going to be talking about labor precautions. So what are the signs and symptoms of labor?
This is a very common question that I get every day, it's important to realize that labor is experienced differently by different women. The important thing to consider is that contractions don't equal labor all the time, and that what we're really looking for are contractions that are making the cervix change. Perhaps the most important thing is we don't rely on the patient to figure out when they're in labor. We have our patients call or ask us.
So what can a woman do if she feels like she could be in labor?
Yeah, I think it's dependent on many things. If it's first pregnancy and trying to really determine if these are some contractions that are strong and that it's probably labor, it's never wrong to come into the hospital and be checked. The reality is that most labors don't happen like they do on TV or in movies. They're slower, and so by all means we recommend calling our office. The nursing line or a physician will give a recommendation for, okay, I think this is labor and you could come in, or it seems like a reasonable thing to wait at home.
There's a lot of information online. People are always searching about things they can do to prevent preterm labor, but what is your recommendation?
There is a lot of information online. I will acknowledge that. Much of that information is not true. Some things that people can do to prevent preterm labor is to not smoke in pregnancy, to avoid significant stress if possible. We do have some limited interventions in cases where someone has had preterm delivery before to help prevent that from happening again. Certainly anybody who has symptoms of preterm labor, that deserves being checked out because we don't want to miss that.
So there are a lot of myths out there about what women can do to actually get labor going. So what's true?
Yeah, I think I've heard it all. Well, that's not true. I hear new things every day. Most are myths. We know how to get it going with medications when needed. We know that there are certain things that cause contractions, such as being dehydrated, which is probably where the castor oil idea comes from, is that it's very dehydrating and thus can start some contractions, but also has significant side effects that most people would want to avoid. Walking is never discouraged in pregnancy. There's a lot of good reasons to do that outside of trying to stimulate labor. There is some evidence that intercourse can be effective as an induction method, and there's evidence to support that. Again, it's maybe not always the most comfortable thing in the third trimester, and how effective it is probably also a little limited.
For women looking for pain medication during labor, what is that window to get the epidural?
That's an excellent question. Most people are very concerned with, am I going to be too late to get an epidural? I almost always say there is not a moment that's too late, although there can be a time where I would say you're pretty close to delivery, and if you're a few pushes away, it might be easier to just have a baby than to go through the strong contractions and desire to push when complete. I'd say the ideal time to get the epidural is in active labor, so about 5 to 6 centimeters dilated with strong contractions, but that's variable, and how long labor lasts is different. I just want to say thank you to all of our patients or potential patients who are out there who have chosen us to be their doctors and midwives in labor. We appreciate getting to do this job every day, and it's a special thing that is unique in medicine, and we thank you. We can't do it without you.
Definitely is. And for more information, go to womenscare.com, and you can also subscribe to our YouTube channel. Have a great day.